Welcome to Thursday Roundtable. We're very excited about our show today because we've got two great guests talking about a very important topic, which is really, issues that are affecting our healthcare staff and ways that we can effectively address some of those challenges that we're seeing. And so I've got two great folks who are on today that going to give us a little bit different perspective than what we're used to, because I have one, which is in the middle of Dr. Luming Li. She is the chief medical officer of the Harris Center located here in Houston, Texas. And then we have a practice leader over labs, has worked in labs throughout the country, lab director, and owns her own firm called Blood Associates. And her name is Dr. Steffini Stalos. Welcome to the show.
Thank you.
Hi, great to meet everyone. Thank you.
Glad to have both of you. Really appreciate you taking the time out. I know both of you are very busy. So thank you in advance. And also thank you to your organizations for allowing you to be with us today. So we got folks already joining us. They've been waiting. Everyone's been looking forward to this. I sent a message out to our healthcare group with over 125,000 members, and dozens have replied saying they want to be a part of this discussion, either live or on the replay. And so if you're watching this live or on the replay, feel free and put in your comments, your questions, your feedback as we go throughout this discussion and kind of make our way through this. Dr. Rosina Malaska, she's already joined us. Welcome, Dr. Malaska. She says, hello from Southwest Texas. It's her last day in Southwest Texas. So thank you for being here, Dr. Malaska. Okay, well, let's get right into this. I want to first of all find out what is top of mind for each of you as you, from your purview, from your perspective. And I know from your side, Dr. Li, you're coming from the mental health perspective, works with very large organizations. And of course, even the one now, the largest agency of its kind, probably in the US or close to it. Tell us what's top of mind for you and what you're seeing as far as issues affecting healthcare staff.
Yeah, I think that being a mental health professional, one of the things that is always top of mind is how mental wellness is being experienced by our staff members. I know that during COVID, it's been a really challenging time for a number of our staff, and that's something that has gotten even more intense because as individuals have been isolated and as we've had challenges in connecting to others, we've had times where we've needed to be away from work. One of the things that I've been thinking a lot about is how are our staff doing? What are things that we can be doing to reach out to one another and really address some of the needs that they have around their own mental health? And so checking in with staff members as well as being able to be thoughtful of their specific needs at any given time is really, really important. And so that's been something that I've noticed. And, as one of the largest local mental health authorities in the country, as Rollis was mentioning, and definitely the largest in Texas, we are seeing more and more people coming in, and anecdotally, they're a lot more intensive in terms of their mental health needs. And so, as the staff that are taking care of them, I think a lot about, well, are our staff getting the support they need if they're taking care of others? And I think that that's something that we all need to be in touch with around our own mental wellness as we go through some of the really tricky times as we go forward and trying to minimize, exposures, but still staying connected.
Absolutely. Appreciate that. And with you, Dr. Stalos, what have you been seeing from your perspective from the lab direction, laboratories and how they're facing things? What are you seeing from your perspective?
Yes. So my background is 27 years in the laboratory industry and 11 years as a physician in pathology and lab medicine. And so I've had my own company, Blood Associates, and most of my experience, but I can broaden it to answer your question, Rollis. Most of my experience is in the independent reference lab space, but there are different labs in that vertical. You got verticals, you got the hospital labs, you got physician office labs, you got a lot of different types of labs. And perhaps what was more felt by the independent reference lab industry with regards to personnel shortages was the ability to find and retain people that are laboratory trained, laboratory professionals for the labs. And as time has gone on, just to kind of paint the picture for you, there has been an attrition of lab professionals, which includes clinical pathologists like myself. From the time of the year 2002 until now, there's been a loss of about 8,000 laboratory professionals per year. And then boom, you have the COVID pandemic, and one of the things, much like mental health, that is a pervasive issue, is the ability to offer critical testing for patients that are in need of further treatment for COVID. And so what happened is there was already this supply chain gap. And then all of a sudden we have the pandemic, which adds fuel to the fire. COVID is by no means responsible for the difficulty in finding and maintaining lab professionals, but it added fuel to that fire. And so now what's happening is from my standpoint, is that it's very hard. It doesn't matter if you're a hospital lab vertical, if you're an independent reference lab vertical, it doesn't matter where you are in the lab industry, it's very difficult to find and retain lab professionals. Sometimes as a result of this, Rollis, and here's where you have to draw difficult lines in the sand between quality and quantity, people need reliable testing. So I don't feel the solution is to get people that normally may have not met the criteria to be in the lab to now be in the lab. I think that's also a wrong way to go. But in any case, that's what the laboratory industry is facing right now.
Appreciate that. Wow, that's so. We've got quite a few things to kind of really tap into throughout our discussion. One of the things I wanted to ask you, Dr. Li, really quickly, because we've got some comments I want to definitely recognize. Thanks for all the comments that are coming in. I will be looking at those momentarily. Dr. Li, from your perspective, do you feel that the experience we've had over the past 2 years, do you feel that if it didn't happen, that some of these same issues would have still be coming up at this time as much as they have? Or do you feel like that it was definitely an accelerator? And if so, how much of a difference do you think it's made?
Yeah, I definitely think that the pandemic has been an accelerator in terms of how people are experiencing mental health needs. I think that more than anything, there has been just stress from all kinds of experiences as part of the pandemic. It could be stress from, being able to connect with family members or lack thereof, having to homeschool, and, kids. It is also trying to engage in, all kinds of different new changes as a result of social distancing and shifts in the care delivery system. So I definitely think it has accelerated the mental health needs. I mean, we just saw a few weeks ago, there was a declaration of, a pandemic, really around child mental health issues that have come out as a result of the pandemic. So we have seen a lot of folks that early in the pandemic, they stayed home, so they weren't getting their health needs met. And then they accelerated what happened with healthcare consequences. And I think that that's still, to some degree, part of the issue that's going on. And so we definitely do experience some of that and continue to experience it. So, I do think that the pandemic has had real impacts on many of us in different ways, but it's really been something that's felt in a very deep and also in a prevalent way, right? Like sometimes you think, oh, the flu may or may not hit me, or you think about what there used to be with avian flu and what that looked like, and it staying in Asia. This was a full-blown pandemic that has lasted for a very long time, and I think people are still struggling to really get a sense of think about the future. I mean, we're sort of at a lower sort of on the down decline a little bit, but it doesn't stay that way. And I think that the unpredictability and also the uncertainty is really scary to people.
Yeah, absolutely. So we got lots of comments that have come in, and when I come back from a comment, Solace, I want to ask you what would you say has been the response of the lab personnel under these circumstances? Like, how have they been addressing some of those issues? But before I have you do that, I'm going to look at some of these comments here. We have lots of folks that have come in. Thank you for all the comments. Of course, we mentioned Dr. Malaska. We have also Stephen Payton. He says, "Hello, all. Welcome to you." I see LinkedIn user. It doesn't say who it is. I'm sure. So hello to you, whoever that is. And we also have Sahil Nurani says hello to my mentor, Dr. Stalos. Wonderful to see you on such a great platform. So glad he came. So you know someone here. Okay. And then we have Shona Elliott. Thank you for being here. Colleen, all these wonderful folks. Okay. So going back to you, Dr. Stalos. How have you? What response have you seen? What are some solutions you've seen to some of the issues that we're facing at this moment?
Yes. So I was talking with the medical student that's rotating with me, Sahil Norani, earlier. I feel, because I mentioned earlier that there was a decline in the lab professionals uh, prior to the pandemic even hitting, that there is, and then there was the kind of proclamation by the government, testing, 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 very early on in the COVID pandemic, early on in 2020. And then it kind of hit a snag, which I felt I knew would happen, because in order to establish a new clinical laboratory, you have to have certain positions filled by law. And so, for instance, a lot of labs can be high complexity that do PCR testing for COVID. You need 5 different positions filled. You need the laboratory director, clinical director, you need a technical supervisor, the general supervisor, and testing person. And for moderate complexity, you need 4, and then waived doesn't have quite those number of personnel requirements. And so I felt like what happened in the beginning of the COVID pandemic was there's push. Okay, let's have more labs, more labs, more labs. And then I don't really have any data on this. The testing, testing, testing message from the government kind of went away, and there was like one article that I saw where lab personnel felt like they were not seen, that they were invisible, because what's happening is if you can't get more into the lab or can't create more labs, then you push the personnel that are available, beyond the hours and schedules and everything. And another tactic that seemed to have been thought of, and even in California with a lab, and I don't really want to name lab names, but they became more creative with whom they would allow. They would kind of look at CLIA requirements for people to come into a lab and be any of those positions. And then, well, it's too hard, so we're going to create some wage requirements. Well, so the lowering the quality, I guess you could say, lowering the bar with which someone has to meet in order to enter the lab in different positions was tried, and that had disastrous effects. So we realized the quantity is not there. We tried a different form of quality, didn't happen. And so I feel we're at where we're at right now is, and thankfully, like Dr. Lee said, we're starting to come off the peak of the most recent surge. There's just a resort to maybe not relying on lab testing to amplify, just use whatever's out there, or send out to a large lab like maybe Mayo or something, and stop trying to create more pockets of labs. And thankfully we have different things to use, vaccines and now oral medication to use against COVID. And I'm not hearing that testing strategy anymore. So that's kind of where I feel we've gone through in the lab industry with regards to COVID.
Okay, very good. So, Dr. Lee, I want to know, what are some things that you've seen, solutions, things that you've done to address some of the challenges that we've had, of course, over the past 2 years. I know you've come from the perspective of 2 different organizations, two very large organizations. So feel free and sprinkle in any of those ideas that you've come across that have seemed to work.
Yeah, I've actually had a large interest in this topic, and so I actually will share experiences from other colleagues that have had success in their hospitals and healthcare settings, as well as my experience previously at Yale and now here at the Harris Center. I think one of the things that is really, really important is checking in with employees and checking in with people that you're working with. I think this can happen in very large ways, such as doing satisfaction surveys and doing pulse surveys. It can happen in ways where you have small groups come together in the form of teams. You might also have just one-on-one meetings with people to check in about, how are people feeling? How are they doing? There's a lot of change afoot. So what are they doing to address that? How are they staying well during this time? Are they having time for family and friends? And how do we all work together to sustain ourselves through the long haul? And so I think that checking in is something that is really, really important. In addition, social connectivity, I think the check-ins help with social connectivity, but there are other ways. I mean, people are starting to use telehealth a lot more in terms of being able to reach to patients and clients that need healthcare delivery, and using technology to be able to reach family members that are far away, as well as groups of people that are further away. So some of the things that I've heard from when I've done surveys at Yale is that it's really neat what today brings. There's been a lot of new innovation, so that somebody who is in New Haven, Connecticut can talk to somebody else further away all around the world if they're struggling with substance use. So it's not just local to New Haven, it's more worldwide in terms of the kinds of conversations that are happening. I think in addition to that, I've noticed that there's just been a lot more intentionality. So people are shifting what they want to do and finding more meaning in being with family and friends, and then also in the kinds of work that they're doing. So not everyone is staying in the healthcare space if they're feeling like that's too intense. And then others are, renewing their commitment to staying in the healthcare space. So it's really brought on this reflection period of being able to really identify what is your life's calling, what are you working on that is exciting to you, and also making time for other things that are important. I mean, I've seen more women during this period sort of go out and want to spend more time with their families. Very high level, well-trained people that did their whole medical career, and they say, well, I want to be with my family, and that's really important to me. And I really say, hey, more power to you. That's just amazing to really reflect on the values that you care a lot about and supporting people through it all. And so whenever somebody comes to me and says, well, I want to take some time off, well, how can I help you do that? And I think that the more organizations that do that, the more leaders that do that, the more of a better culture that we can make for the individuals that we're serving, from the client side, from the patient side, but also from our employee side. And so I think whatever we can do to provide that support can really enrich us in terms of a better future, a committed future, and a passionate future to delivering high quality care to others.
I think, when you just said that about when someone asks about taking some time off, and you said, how can I help you do that? This is how I think a lot of our audience felt about what you just said. That was great. I love that. I wasn't expecting you to say that, but that's a wonderful thing. I'm sure that it impacted them when you said that. Quite a few more folks have come in. Thank you for all the comments. Lots of folks are watching. We have Brian Hudson from St. Pete, Florida. He says St. Pete, Florida is in the house. And then we have Bradenton, Florida as well. Kelly McGrath. So thank you for being here. Leah Ramsey. I think you know Leah Ramsey, Dr. Lee. She says hello. Glad to see you here on our Thursday roundtable. And Dr. Malaska, she says, Rosina, she says, wow, that is a surprising stat or thing you said, Dr. Stalos, about lowering the quality of lab personnel requirements. Maybe we can kind of dive into that a little bit more. So it was because there was so much of an emphasis on testing, you had to kind of figure out ways to do that, and that had to be sacrificing some quality. Is that the point you were making earlier? I want to make sure I got that clear.
Yeah, and let me clarify on that. It wasn't that the requirements were downgraded. It was that this particular company took it upon themselves to create some political collaboration, say, can we not require this? Can we not require that? They did address it. And
okay.
I guess the powers that be, I'm trying not to use names, but people know who's in power in that area. So sure, let's try that, and I understand this has been a time of survival. I mean, if you want to stay alive or you want to keep other people alive, there's things to be tried. And so with that understanding, with that lens, and it could have been predicted ahead of time that if you waive some of the requirements, and the requirements are under the clinical laboratory improvement amendments that list what kind of education and background experience is needed, if you start to waive some of that, especially in the higher complexity labs like this one, it's going to lead to results that are not helpful to anyone and could be hurtful. And it's funny, in the laboratory world, we use certain lingo, but now it's become part of everyday language. If somebody says, hey, don't use this COVID test, it's got too many false positives, and don't use this COVID test, has too many false negatives. Before the pandemic, nobody would have known what are you talking about. But now, because it's part of our survival, I definitely, you probably, I don't want to hang out with someone that's false negative, because or you wouldn't know, but maybe a certain platform gives false negatives. Now you don't know, is that negative real or what? I mean, now you don't know. So, yes. So in any case, I would not recommend that. And in fact, now we have a trial through that, and we see that that's not going to be helpful. And it's very difficult because laboratory medicine is a branch of medicine, and we want to see people be healthy. We don't want to, no one is trying to say, oh, something is needed here and we just don't feel comfortable. No, not at all. And so this has been a very difficult ride for laboratories who are normally not thrust into the spotlight like this. But now that the laboratory industry is in the spotlight, I think this is actually a good time to talk about what's needed for the next pandemic. So let's not forget, and I'm not trying to use scare tactics, but there's a cyclical nature to pandemics. They don't just come and then you never see them again. And I was watching Dr. Kim in Korea, who did a very good job in the beginning of handling the testing for Korea. And he said that pandemics recur about every 5-6 years. So to me, it's very, very essential we get a playbook of what's happening during the COVID so that we can defend ourselves for the future, pay it forward. And anyway, that's my take on that.
I like that. I love that. Okay. So I got lots of comments to read, but I want Dr. Li, I want you to think about this question I have. We've had a shortage of psychiatrists before the pandemic, but I'm sure it's been being exacerbated now since it's happened. How do we take care of the psychiatrists themselves and make sure they're also cared for so that they can continue to care for patients? So as you're thinking about that, let me just go across some of these comments here. Dr. Molas, by the way, she said, thank you for the clarification, Dr. Stalos. And then she says, at the front lines where I've worked across the country, travel nursing, the lab techs and lab personnel have experienced the same type of stressors, and burnout with very little support, as nurses and other healthcare workers have been. And we also have Precast Jane. Thank you for being here, as well as Muhammad Abdul Shakur. Hello back to you as well. And then we also have from Colleen. Hey, Colleen, good to have you. She said it was a way to treat people fast without people dying while red tape was sorted. Interesting. Red tape. Oh, red tape was sorted. Thank you. I was trying to make sense out of that. Okay. While the red tape was sorted. Yes, that makes sense. Thank you. Okay. So Dr. Li, back to you. First of all, we had a shortage before. and you can tell us if things have improved. I don't think they have. How do we take care of the psychiatrists to make sure they can still keep helping people?
Yeah, I think as a healthcare leader, this is something I think about a lot in terms of, well, how do I make sure that the workforce that I have is invested, engaged, and caring for these very vulnerable individuals that have serious persistent mental illness and continue to be in crisis, and have these dark thoughts and are coming to us for help. And I think that there's a number of different strategies. One is that with physicians, a lot of times they're not always able to practice at the top of their license because of needing to complete a lot of paperwork, or they might be tasked to do a lot of other, tasks that aren't necessarily the role of a physician. And so one of the things is to get the support in place so that our physicians can really be at the top of the license, so that we're able to maximize what their role is in the healthcare delivery space. I think that with the role of psychiatrists, I think that there's going to be a need to really reposition psychiatrists as leaders in the clinical care setting, such that they're, guiding the team on how best to care for individuals and shifting them away from doing, certain things like, doing only med refills, or just sort of seeing people for short periods of time so that we see as many people as we can, but really positioning them to care about the holistic aspects of a patient's needs and being able to be the team leader. And I think that there's already models out there that have looked at that. And so, for example, one of the highest evidence-based practices that has been utilized nationally is a model called the collaborative care model, which was developed out of the University of Washington psychiatry department. And what it does is that it has a care manager, a different role in the healthcare space. And the idea is to have that person be the quarterback, but the psychiatrist really utilizing a role to supervise others and being able to provide guidance to primary care providers on how do I support the needs of individuals in a large primary care practice, so that the role of the psychiatrist isn't seeing every single patient, but really guiding a different practitioner and giving expert help to really then maximize their role in the care delivery space. And so I do see that psychiatrists can be leaders. I also see that we can try to reduce their work burden so that we're not having providers do all the, paperwork burden as opposed to caring for patients. And I also think that psychiatrists are caring for themselves. So one of the things that we learn in psychiatric training is how do we use model and continue to have self-care. And so many of them are self-selecting into roles that allow them to have the space. And actually what happens when there's an economy of demand and not enough supply is that the price for care goes just way up. And so we're definitely seeing that in the marketplace, where a number of the telehealth companies are paying a lot for psychiatric care delivery, but that puts large mental health agencies a little bit at a disadvantage because our patients are some of the sickest, and we still do need to find psychiatrists to deliver that care. And so that is definitely one of those items that is top of mind for me as well.
I can imagine. Wow. Yeah. Okay. So I love the points you hit. The first one I got from it was, first of all, let's have them not do all this medical related stuff, or at least not as limited as much as we can. And I'm hearing things possibly like maybe using a scribe or some kind of assistant maybe to help interact with the medical records. Is that kind of what you're talking about too?
Yeah, there's a couple of different things. One is that you can try to reduce the note burden. So what that means is that you have them only write and document things that are absolutely necessary, that are important for caring for the patients, and not have them sort of add to the note clutter. So what happens when in many of these EMR systems is that notes just get bigger and bigger, and there's a number of studies showing that. And so you can actually declutter a lot by just taking a revisit on notes and saying, and psychiatric notes are pretty long, and so taking a look at what truly needs to be in there and what doesn't need to be in there. But I also think what you mentioned, Rollis, that having a scribe is really important, because I've seen it work really, really well in being able to have a scribe. I think that one of the things that we have to be careful of as a psychiatric care delivery setting is also privacy, and people sometimes feeling vulnerable to reveal some of the personal details that impact care. And so when you have another person involved, it can sort of maybe not always be the most appropriate, and not everyone's going to feel as comfortable. And so,
Right.
I've seen it work in some settings where scribes are really, really useful, but in certain other settings, it's a little bit of a deterrent in care, and can be perceived that way, to the point where sometimes, even when psychiatrists have, medical students, they have to ask for permission, and some of the patients do say no. So I think, it is a really good idea. I think what I was also referring to is that there might be other providers in the care delivery setting, so nurses or pharmacists or, physician assistants or nurse practitioners who may be able to fill in some of the portions that a psychiatrist needs to fill in, but is able to take that history, get a medication reconciliation such that the psychiatrist, when you're ready to see a patient, you're able to utilize the most current information to be able to then guide clinical care and treatment, so that you're not spending a lot of time on things that somebody else could have helped you with.
Makes sense. That makes a lot, and I've seen that happen with in the hospital setting too. When it comes to nurses, having perhaps the CNAs or the techs do things that really Darn doesn't have to do, and like you kind of said earlier, making sure that the psychiatrists are doing things that's more at the top of what they're licensed for versus things that maybe they don't have to do every single time. So I love that. Oh, you're going to say something? You got a follow up, Dr. Lee. I can tell. What are you going to say?
Yeah, exactly. You got it.
Okay. And Dr. Malaska says, love the analogy of the quarterback. So that resonated with her. Brian said, have you seen an increase in pay and comp plans for lab professionals as we've seen in other professions? And before you address that question, Dr. Stalos, it's time for our water break. So if you have some water or tea break, whatever it is. One of my guests instructed me to do that. She said you should take a break during the show and drink a little water or something. So, okay, so that's why I did that. Okay, so go ahead, Dr. Stalos. What's your answer to that question? What have you seen?
Okay, what I've seen is, due to the dire need of lab professionals, but due to the opposing reimbursement of labs for executing certain tests, pretty much I want to say the answer is no, not an increase in pay and compensation plans for lab professionals, kind of with the exception, and might be something you're very familiar with, Rollis, is the travel nurse or travel MT, MLT, which I've seen kind of advertised in different job spaces. And so for people who are willing to travel and work in the lab, it seems, pretty good compensation, but that's kind of a short term. I've not usually seen that for labs. And so that's my answer. Not really, not an increase.
Not much has changed. How about on your end? What have you been seeing? I noticed you mentioned a little bit earlier that it's affected rates to the point it's made the costs go up, Dr. Lee. I don't know if you want to touch on that anymore in terms of what you've seen in terms of salaries for psychiatrists and other caregivers in the mental health care space.
Yeah, I've definitely seen that care is going up in terms of what people are willing to do. I think that what ends up happening is that you'll see individuals taking on jobs that aren't as taxing. So instead of being at the front lines, they might be doing telehealth in their home, so that they can care for their loved ones and be there for after daycare or after school. So they're cutting back in terms of the total amount of work that they're doing, and they're also taking on jobs that are sort of keeping them, further away from the lines. Even for inpatient level work, where previously we would have said, okay, you have to show up, you have to see people every time. There's been telehealth approaches to trying to do inpatient care too. And so, I think sometimes it, leads you to question, okay, is it going to be the most high quality care? But at the same time, I think that because of this big shift to telehealth, and because people are willing to pay almost the same price for telehealth care as it would happen in person, there's been a movement toward, I've seen more and more people take on jobs that are a little less at the front lines, which makes people at the front lines really want higher salaries and want bonuses. And so you sort of have that dynamic playing out. I don't know exactly if we take a look back in the market. I suspect that over the next year or two, we'll start to look at some price increases. I think the other thing that's been kind of tricky is that inflation has gone up 5%, right? So if you don't increase the labor costs and it's a competitive market, you're going to fall behind. And so, I think that in certain settings, like government settings, it's actually hard to just do a 5% increase on pay because you're functioned as a grant. Giving agency, and the budget just doesn't always accommodate that level of expense, especially since physicians are some of the most expensive, individuals in the healthcare delivery area or within an organization. And so, there are these different competitive situations that take place that make it a little bit harder. So in terms of dollars and cents, where that all lands, I will be eagerly looking for how the trends go. But from now, just from anecdotal as well as from recruiting experience, it's just been a much harder market than I expected.
Yeah, I see that too from our end, because we're in that space. And do you feel like, let's say 5 years from now, and both of y'all can comment on this, do you feel like, let's say 5 years from now, like using your quarterback analogy earlier, Dr. Lee, I believe it was Dr. Lee who said that. Do you feel like the physician is pretty much going to be doing less of a lot of the things that they're doing now, and that it's going to be more of these other folks? Perhaps maybe it's mental health counselors in your area, or nurse practitioners who are psych trained, or as far as the labs go, the MLTs, I think you mentioned earlier, Dr. Stalos. Do you see a trend where more of those other roles will be used, and that way the doctor can perhaps by extension care for more patients in a less stressful environment? I mean, I'll let you take that, Dr. Stalos, and then we'll finish up with you, Dr. Lee, on that. How about that?
So I guess the future will tell. To answer your question, Rollis, due to the clinical laboratory improvement amendments being what they are, it dictates who can be in certain roles. And depending on the complexity of the lab, a medical technologist can be a laboratory director if it's of a certain complexity. And so, yes, it's possible, but we're dealing with the gap in training for MLTs, MTs. So, possibilities there, but who knows? And so I'm not sure there's a way to create more of the what Dr. Lee was referring to, more of that quarterback type of team, and allowing the physician to branch out and do some other things and delegate. I think we're just we just need to concentrate on getting, obviously, if we don't have enough, we need more. And I think if someone said, what is asking me what the solution is, we need infrastructure. And what do I mean by that? There needs to be a collaboration between, I feel, the government, the lab professionals, and the training programs, because we need to get on the same page. I know that businesses like to, operate on capitalism and have all the ideas and start their new companies, and some of those are lab companies, which is a good idea. However, when it comes to guarding the public, safeguarding the public, I would, and I have put this out there, I've written a grant for it, it didn't get funded. I've advocated for increasing the infrastructure for the laboratory response network, the LRN, which has already been in place since 1980s. And I feel with the pandemic, we need to really augment that. And of course, I'm not a part of the government, so it's not going to happen unless, again, the government and lab professionals and training programs get on the same page to say, hey, if we have another different pandemic with the risk assessment of COVID or worse, what would we need to do to get at a point where it's not going to wreak havoc and hurt people? So I feel like going that way is better. And of course, getting more MTs, MLTs, getting more, but we need to have a concerted effort. It needs to create a certain effect, I feel, too, because I'm worried. I'm worried about the next pandemic. We had a hard time with this one. So that's my thought.
Okay, appreciate that. How about you, Dr. Li?
Yeah, so one of the things I follow is that I look at the number of psychiatrists that we're producing against those that are retiring. What we're looking at is a huge number of psychiatrists that are going to be retiring over the next 10 years. So what that means is that I don't think our production rate is actually matching with those that are retiring. So I don't think that the role of the psychiatrist is getting replaced anytime soon, just because of the high demand, as well as just the overall, not high numbers that we're producing, right? Like, this is a relatively small group of people that are graduating because the GME has not expanded very quickly. There are a lot of guardrails against that. I think one of the things that I am worried about is really around socioeconomic division. So what I mean by that is that psychiatrists can charge a lot of money to see patients and individuals cash. And so what that leads to is you will have individuals that are charging a lot of money for pediatric care that's high quality, that is done by a psychiatrist. It's very comfortable for the psychiatrist to do this, and it's what we would call a private practice. And many people make a wonderful living in that way. And those numbers and those costs are going up. They are not in any insurance panel, and they will just charge cash for care delivery. And so as people sort of recognize the profession in a lifestyle way, that sort of is a little bit tricky, because some individuals aren't going to have the socioeconomic status to be able to pay that high for high quality care and timely care. And so what that leads to is socioeconomic divisions around who gets access to care. And so those are some of the things that I worry more about than individuals that are MPs or PAs that are gonna, I just think that there's more work than we can ever really meet the demand for, especially in mental health. I mean, this is just the next area that people are talking about in terms of the onslaught of what's happened with the pandemic. People are really caring about what's happening in mental health, and it's very interesting. There's a lot of investments recently in mental health, even though it's been ongoing for many, many years. But through the pandemic, there's been a lot more recognition and money invested into behavioral health.
Appreciate that. We've got lots of comments that have come in. Wow. I don't know if I'm gonna try to get to as many of them as I can. But thank you for all the comments. I love it. And those of you who are on this, watching this, connect with each other. We've got some great networking, connectedness going on in the comments. So feel free to connect with each other. We're here for a common purpose, which is to see healthcare improve. So Monique Albornoz, hopefully I'm saying that right, Monique. Thank you for commenting. She says, regarding Dr. Luming Li's comments about providing support for frontline staff, one way to care for the caregivers is to create environments that best support staff providing patient care. And Colleen says coaching can help frontline staff an opportunity to staff to decompress. And Rosina, Dr. Malas says, yes, for critical care nursing, many facilities allowed us to streamline the daily shifts charting while still meeting the regulatory and legal requirements. And this freed us up to spend less time on documentation and more time at the bedside. So before I move on and read any more comments, anything that you wanted to comment or piggyback on off what I just read, Dr. Lee or Dr. Stalos?
Not me.
Okay. Dr. Lee, do you want to piggyback before I move? I can read more.
Yeah, I think that I do think the role of coaching is really helpful. I've seen the use of decompression huddles to be able to help support frontline staff, where psychiatrists or psychologists will round in intensive care units where nurses are struggling or need help and support. I think one of the challenges with healthcare providers is they're not always going to raise their hand and say that, hey, I need help right now. And there's going to be some challenges to even detecting that there is burnout or changes to how we feel. I think one of the positives is that I think there's been much more of an interest and engagement and awareness of mental health and mental health needs. When our star athletes go to the Olympics and take a mental health day, it sends a really big message to the society and to our culture. I think that our healthcare heroes really deserve to have some time to themselves as well and to be able to decompress. So I've been sort of different avenues to do that. So we also had town halls where we would have frontline staff come or individuals of need come and talk about some of their experiences. And they're very vulnerable experiences, whether it's things like microaggressions that can happen at work or diversity equity issues that come up. There's also things about the pandemic and how it's impacted us in terms of, our fears and anxieties about keeping our family safe. So I've had those conversations too. And so there's a lot of different types of conversations that can occur. But I think what needs to happen is that there's got to be a higher leadership commitment to doing so. I mean, the structure needs to be developed, and oftentimes there's a lot of really wonderful people doing great work to support our caregivers, but there's got to be that commitment to do so and the resources that are alongside that so that we can really provide the staff what they need.
Oh, I love that. Appreciate that. Shona also says, in response to Steffini's comments about compensations for laboratory professionals, has there been advocacy for increased funding, reimbursement, and comp for laboratory professionals? They're such an important part of the healthcare system. Before you answer that, I have one more comment to read. Shirley Lee, she says, we're using care navigators as the quarterbacks for patient care. They also help with coordinating care and paperwork so that the physicians can work at the top of their license. Are caregivers effective in the psychiatric care space? So maybe Dr. Salas, you can take that last comment, question or comment, and then Dr. Lee, you can take the other one. Uh-oh. Dr. Salas is frozen. Either that or she's very good at being still. I think she's frozen. Okay. By the way, so Dr. So why don't you go ahead and answer, if you don't mind, Dr. Lee, about this? Are there care navigators effective in psychiatric care space? Have you seen that being used well?
Yeah, I think that all members of the care team can be affected through the pandemic. One of the things that we've noted is that when I go out and do leadership rounds with different individuals that participate in care, I usually ask, hey, how are you doing today? What are things that, that you're navigating? How can I help? And different people will tell me different things. As care navigators, I've had conversations where they felt like they've needed to do a lot more. Their jobs are changing. They've had to fit more patients in, or things are a little disorganized and they have to sort of help out with it. And so, I do think that different care individuals and providers are affected differently. And so, in my own personal experience, I've noted that some of the things that we have to do is recognize that people are really stepping up to the plate and going above and beyond in their individual areas, and that oftentimes it's more work, it's different work, it's just a a lot of new changes that are happening at any given time. And so we have to be respectful and thoughtful. And oftentimes when we're feeling overwhelmed, we can be short and irritable and, not as supportive to our colleagues. And so we have to do some checks, and we also have to provide support to individuals that might be feeling overwhelmed at any given point. And, I have seen that happen when I've connected with others, when I've done my leadership rounds. And so, that's something that I have to keep in mind, that we're all affected differently. And oftentimes it's the individuals that are taking care of others and care navigator and care coordination roles that are oftentimes just affected the most, because they're doing a lot of the work and connecting with patients, reaching out and managing the care. And so I oftentimes think that we have to do an extra bit of outreach to those individuals.
Appreciate that. Okay, and then we have so many more comments, but you know what? I want to ask one fun question before we leave, since we're coming towards the end. Okay, if you had to choose, I don't know if you're kind of a risk taker. If you had to choose, would you rather skydive without a lesson or scuba dive without a lesson? And those are the comments. I want you to answer the same question.
Yeah, so for me, I think I would probably do scuba diving.
Okay, why is that?
Because skydiving feels like I have a really fast, need to respond, where gravity is going to pull you down real fast, and if I don't figure it out, we're going under. Whereas scuba diving, I think, I'd have a little bit of time, right? Maybe a minute and a half, maybe a little bit more. Who knows? I mean, I can hold my breath for a while, right? So, I think I have a higher chance of survival on the scuba diving piece.
That's a good one. Robert, thank you for coming in. Robert says hello. Carlo Iani, he says skydive, pull the cord and go. Wow, he's ready. Okay.
And people know. What if I pull the wrong cord, right?
I'm with you, Dr. Lee. I'm going to go with the scuba diving before I would try skydiving without lessons. Okay, and then really quickly, let's see, we got and actually Colleen, she's in South Africa. She says they're expecting a fourth wave in December because that's their summer in South Africa. Mm-hmm. Wow. So this thing is not over, especially in some places. Quickly going through these comments, make sure I address anything before we wrap up here. Dr. Malaska, she says, Colleen, what we nurses have been doing is we support our allied health team, RTs, PTs, lab techs, radiology techs, by spending a few minutes in our shifts checking in with each other, listening, especially in downtime. It has brought us closer as a care team with the same goals. I seem like you remember. I remember you saying that earlier, right? You said you called it decompression. Is that what you called it?
Mm-hmm. Yeah, we did a thing called decompression rounds or decompression huddles.
Okay, very good. So like those are similar. Does that sound similar to what she was explaining? The way she explained, is that kind of how the decompression worked?
Mm-hmm. Yeah, I mean, what we would have is we would have individuals with mental health care training go out to different settings, whether it's ICU units or talking to individuals that are working in the fields, and just doing 5 or 10 minutes, just huddle together, talk about what's been on our minds, how things are going, try to address some of the acute concerns and also the experiences that people are having, and then sort of take note of it, and then try to provide some resources and ideas on next steps. And so that seemed to work pretty well. I mean, at times what's tough is when you go to settings where people are too busy to even take a 5 or 7 minute break and be able to have those conversations. And I think that my colleagues had encountered that at some points. And so, I think engagement is one of the indicators of whether or not we have a healthy workforce. If we have an engaged workforce, and sometimes it can be tough to be able to have that little bit of a break because there's just so much going on and so many demands that we have. But it is important to do a check. And so maybe one of the things I'll leave the group with is this idea of just taking a moment, even if it's a minute or a couple of minutes, to do some deep breathing and to really reflect on, what are positives in your life. Spend some time sitting and being able to focus your energies on the positives in your life and also perhaps in others' lives and thinking about what a brighter future can look like. And usually that can sort of energize you a little bit. It sounds like a small task, but I've definitely done things like that and it helped me get through the day.
Awesome. Really appreciate it. Just getting the screen fixed. It looks like Dr. Stalos wasn't able to get back on, probably internet issue, but we want to thank Dr. Stalos for coming on today. Appreciate your time with us. And Dr. Li, really want to appreciate you. Thank you for taking your time. I know that you are incredibly busy, and so is Dr. Stalos, but really thank you for taking your time out to spend it with us. And folks who comment, who I didn't read your comments, I apologize. I am going to read all of them. And Dr. Li is also tagged in this. So Dr. Li, you'll have an opportunity to look at these as well. If someone had follow-up questions, what's a good way to follow up with you, Dr. Li?
Yeah, feel free to email me at my agency email address, which is luming.li@thehaircenter.org. So feel free to reach out if you have additional questions, and Rollis and his team know how to get a hold of me, so happy to be in touch.
Thank you so much. We had a great time. So let's say bye to everyone. Bye, everyone. Thank you for joining us today.
Bye, everyone. Take care.
Stay well, everyone. Okay,
Take
one
care.
second here, and then we'll be able to hit